Nice. Any more? Good. Okay. Anything else? Energized. Very good. So probably this is the second day. So you'll be high. Not high. High. So I'll be talking on a very important topic, that is addiction. This is not in your first year curriculum, or this is throughout your life. I'll be talking on this. That is why I asked you, how are you? We'll be talking on some important part of our brain, and which are very important throughout your journey, throughout your curriculum, and it will help you longer also. So, my name is Dr. Vijay Patil, as Madam has introduced. I am Deputy Dean here, plus Professor and Head in Forensic Medicine. And I teach Forensic Medicine and Toxicology. And I have one more additional hobby. I'm taking awareness classes, awareness lectures, awareness programs, prevention and addictions. So, we'll talk with this current topic, addiction. Addiction in youth. So, before starting this topic, everyone should know what is addiction. As per the National Institute of Drug Abuse, addiction is defined as chronic relapsing brain disease that is characterized by compulsive drug seeking and use despite harmful consequences. That means the person is knowing that it is harmful to us, harmful for me, harmful to the family, but still he cannot avoid, because it's a chronic disease. Not only chronic, it's a relapsing disease. The patient again and again goes in relapse stage. That is why it is called as chronic relapsing disease, and where the person is habitual to take the drugs, compulsive, in spite of harmful consequences. But the question arises, why do people use these drugs? So, any guess? Yes? Yes, very good. Short-term enjoyment. Boys? Cope up his strength. Okay. Peer pressure. Very good. Feeling of euphoria. Very good. Then release from stress. Very good. Give him a big hand. Because we are talking on this line only. He has talked very nicely. This is all is there. People are taking these drugs for these reasons, but the main reason is why people going in the addiction is stress, anxiety, depression. And these people are more in this addictions. So we'll be talking on this line at stress, anxiety and depression also. So some are these reasons I will just summarize. It looks good now. The celebrity smoking, and we follow them because they are idols. No? Okay, good. So to forget the problems, as someone said, energize, relaxation, sleeping, it acts in both ways. Sleeping also and stay awake. I don't know how it is acting. People want to stay awake, they stay awake with these drugs. If they want to sleep, they sleep. It's strange, no? Then, very important for students, that is boredom. No, I don't know this definition of boredom. Anything, if it doesn't goes in our line, then person feel bored. Now Dr. Patil came here and he is talking about addiction, what is it related, I don't have in the syllabus, and I am feeling bored. I'm going in the hostel and some activities are going on and I'm not getting energized with this and I'm bored. Even that, not having a phone with you, still it is a bored. That doesn't mean you should go in this addiction. Depression, to gain confidence, somebody said, be cool. Cool. Yes, teenagers and you college students, they go for this only. Be cool, man. I'm getting to becoming a doctor and relax, socialize, friends. Somebody said peer pressure. These are all reasons. Few more. This is also ideal. Now, not in your days, but in our days, he was our big hero. He was found in drug addiction, and after that, he had gone for rehabilitation. If you have seen this movie, Sanju, very good. In that movie, he ran away with the from the rehab center, and it was shown how he was addicted and all that. One more celebrity name, good singer. Good singer. He is missing for the last 4 years. Yeah, yo. Oh, very good. After 4 years, 9 years, okay. But he was not only in drug addiction, he was also in depression. So if you go high, you have to come down also. You cannot be high every time. Some more reasons: sex, sports, religious rituals. In some religions, they allow us to take this bhang and all this. Excitement, reduce anxiety, experiment. I've highlighted this experiment. This is the trigger. Experiment. क्या होता है? देखते हैं. And the person who is sitting next to your table will be always saying, कुछ नहीं होता. इतने से तो कुछ भी नहीं होगा. अरे ये तो start with the pint. Start with the breezer. क्या breezer? इसमें alcoholic content बहुत छोटे कम है. Start with the low alcohol content beers. 4% है. 4% तो कुछ भी नहीं यार. स्पिरिट में भी उसमें ज़्यादा होता है. Start with this only. So that experimentation is always good. We have learned in science also, do experiments. But experimenting on us is difficult. कभी हम सल्फ्यूरिक एसिड एक्सपेरिमेंट करने के लिए खुद के ऊपर नहीं चलाते. We try on others. और कभी भी फार्माकोलॉजिकल या फिजियोलॉजिकल एक्सरसाइज in our days we used to dissect frog, we used to dissect earthworm. दूसरे पे करते थे. क्यों? उसकी नर्वस सिस्टम ढूंढनी थी, उसकी जीआई सिस्टम ढूंढनी थी, उसका लिवर ढूंढना था. हम खुद पे नहीं करते ट्राई. बट I don't know bad things why people experiment on ourselves. Important reasons: avoiding this withdrawals. Those who are in addiction, chronic addictions, they go for withdrawals, and because of that they will be wanting these drugs. To reduce pain. This is also an important factor in some cases. Somebody said here, emotional pressure यही है. Just now I talked. Somebody is forcing and बस क्या, तो दोस्त नहीं क्या मेरा, इतना दोस्ती के लिए इतना भी नहीं. एक पेक से क्या होगा, एक पफ से क्या होगा. Take one झुरका, one smoke, nothing will happen, and you will cough. अरे ऐसा नॉर्मली मुझे भी हुआ था. Don't worry, अगली बार नहीं होगा. You will never cough. You take this, you become high, you will be feeling very good, excitement, euphoria, all what not. So that emotional pressure has to be seen. I think you people are so grown up and you understand what is emotional pressure. You don't have to explain this. And we should avoid this emotional pressure. Emotional pressure कहाँ पे? चलो खेलने जा रहा है, that is good. चलो कहीं पे activity करनी, कहीं कुछ research paper publish करना है, some activity, classes, learning, test. This emotional pressure is good. But doing bad things is not positive. Celebrations. ज़्यादातर I have seen the youngs, they are involved in this trap. सबसे पहले I am running a de-addiction center of my own trust, and I ask the people, when you started your drug, when you started your alcohol, and he explains, I was in college, I had gone for a party, and then all people were drinking, and they forced me. Because of that force, I started. And everyone was taking. Nowadays, the society is like, if you go in any society, I was staying in Nasik for the last 12 years, and I find there, the people, the families, even my society, the people, they are very fond of going with the parties, with the families, with the females, and taking drinks. Nowadays, they say that it is a social get-together and it's accepted, but not. Same again, force. Something very new. I think some must have heard about this. I think in your syllabus also, in 12th and all this, they must have taught you these chemicals. They are very important chemicals. Dopamine, serotonin, oxytocin, endorphin. What is the role of dopamine? What additionally does? Very good. Now, सब आपका brain इसी के ऊपर चलता है. That makes you feel happy, they makes you sad, they make you depressed, they make you anxiety, they make you tense. So ये सब chemical लोचा है. ये 4 chemical जिसको समझ में आए हैं, he will never be depressed in his life. He will never be stressed. So what are the functions of this? Serotonin. Serotonin is mood stabilizer. I'm not talking about the brain and where it is located, where this hormone is secreted, what is the chemical formulation. I'll just talk about where they are acting and how to refunction in them. Serotonin is a mood stabilizer, more sensitive to diet and any other neurotransmitter. Second is last in the below line, oxytocin. Oxytocin is a hormone where it is used commonly. Where in child? Again. 2 things. Yes. It is also called as love bonding hormone. Love bonding means during lactation, milking. And second, very important, when at the last labor pains, oxytocin is more released, and because of that there is a delivery. So it is called as a love hormone. So oxytocin is also a happy hormone. Third is dopamine, the reward chemical. Reward means if you set something goals, and if it is achieved, the dopamine gets released. You get high. Say, today I have planned, tomorrow I will learn this chapters. And at the day end, if that chapter has been read, or the pages has been completed, your dopamine is released. Or good example, when we are going for NEET examination, after NEET examination, immediately after the result, or immediately after the, what do you call that, copy comes, OMR sheet and all that comes, and if you check that and you find, it is more than 550, it's 600, and dopamine goes, because you worked hard for that achievement. For 2 years, you have worked hard, and because of that, there is a huge release of dopamine. You feel good, and you start in excitement, you laugh, you dance, and that dopamine is sustained for so many days also, sometimes. because it will be secreting again and again. So whenever you control your brain and say that I want this achievement, and if that achievement is done, you get a dopamine. Sorry, one more hormone, endorphin. It is also called as painkiller. Painkiller means here, literally, there are studies when the person, he was in a severe pain, a cancer pain, a neurologic pain, backache, after operatives, and he was suffering from severe pain, and after that, with some exercises, with some things, he has changed. There was no pain. There are scientific studies. This is because of endorphin. It's proved. So these 4 hormones, all of you got it. They are very important. I've just highlighted here because the time is very less and I have to talk very much. So you can Google it, search it, study on these hormones. At least one day you do this homework in the evening and read and put on this wallpaper also what this hormone does. I'll show that slide also. What do you have to put? The first hormone, that is dopamine. Brain. So कैसे ये secrete करने के लिए मजबूर करना है. So dopamine will be secreted after listening to the music. चलो आप डाउनलोड कर लो आज Spotify, कौन सा म्यूजिक का, और Amazon प्राइम का, Amazon म्यूजिक. Download this app, at least taking bath or taking when you are getting ready, listen to the music, dopamine will be high. Get moving here and there. Aimlessly मत move करो, कुछ तो भी intention से थोड़ा exercise करो, ऐसा इसका मैं कहना है. Get quality sleep. How much is quality sleep? For medicals, it's 7 hours is sufficient. 8 hours earlier, it was good. For children, it is more than that. Eat enough protein. That is also a good dopamine releaser. Then serotonin, next. As we talked about, it's a love. So because of yoga, spending time in nature, good nature is there in our campus also. You don't have to find anywhere. Be in the sun, but for that you should be available outside. You are always in the classes. When you get time on the Sundays, you can be in the sun. Not only that, you will not with the serotonin, you will additionally get what vitamin? Yes, madam is sitting here. We should biochemistry. Vitamin D is the biggest source of vitamin D is sun only, not its supplements. Oxytocin, it's a mood stabilizer. It's a love bonding hormone. Giving a hug. I think a good movie was there on this. Yes, movies बहुत अच्छे आते हैं. Munna Bhai MBBS used to hug, and I will tell you, it literally works. It literally works. You hug with your family, you hug with your pet, you hug with your any friends, and this hormone is released, and you feel good. You feel satisfied. You help the friends, you get satisfied. Dinner with the friend and families, yeah, possible nahi hai, but when you get time, give compliments. ज़्यादातर होती नहीं है, but देना पड़ता है. Because my hormone is secreted. उसके लिए नहीं, मुझे मेरे लिए करना है. I have to give compliments because my hormone will be high, and I'll be feel happy. Then endorphins is a painkiller. Move your body. जितना एक्सरसाइज करोगे उतना पेन कम होगा. अभी some doctors are saying pain है, don't move, don't do exercise, take a rest. Opposite is this. अभी एक्सरसाइज करना है, अभी मेरे पैर दुख रहे हैं तो मैं पैर की एक्सरसाइज करूँगा क्या? मेरे हाथ दुख रहे हैं, आई एम having a pain in the neck, should I move my hands and my neck? You can move my legs. So like this. Very good. Next is laugh. So nowadays if you see, if you are in metros, every gardens, early in the morning, the senior citizens, they start laughing, ha 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 ha. It's a exercise. They are releasing their hormone. They feel good, they feel happy. Be creative. यहाँ पे क्या क्रिएटिविटी करनी है? अभी तो इतना पढ़ना है, इतने बुक्स आ गए, कल ही बुक्स खरीदे, वो बुक्स देख के हमको परेशान हो गए हम लोग। और क्या क्रिएटिविटी करेंगे? अरे उसमें भी क्रिएटिविटी है, यू कैन फाइंड, यू कैन डू थिंग्स, देयर आर सो मेनी फेस्टिवल्स, सो मेनी थिंग्स आर देयर, यू टेक इन्वॉल्वमेंट, टेक पार्ट इन दैट, सो मेनी सोशल एक्टिविटीज आर देयर, यू टेक पार्ट इन दैट। Dark chocolate, I think it's a favorite of everyone, and you feel happy about that. And not only that, if you take a sugar also, the good hormones, they are released, happy hormones. The important in these 4 hormones is dopamine, because we are talking about addiction, we are not talking about depression. So when we are talking about addiction, the dopamine is very important, and the people, they take drinks or take a drugs or take a puff or take a go for smoking, they think that I get high because of this drugs only. They don't know what is secreted, but it is secreted, and they feel happy, they feel good. But there are other ways also where we can hike your dopamine. That is, these things, very simpler things, lot of proteins. What are the rich source of protein? Soybean, veg वाला ठीक है, नॉन वेज वाला egg, chicken, highest quantity of proteins. Paneer, very good. Sprouts. This will help to increase your dopamine. So whatever you find that is rich in protein, they are secreting dopamine. Consume probiotics. अभी तो मार्केट में भी मिलते हैं probiotics. Eat less saturated fat, oils. Do a lot of exercise. टाइम ही नहीं है सर, 8 बजे लेक्चर चालू होता है, 5 बजे ख़त्म होता है, उसके बाद पढ़ाई, फिर के बाद ये वो होमवर्क एंड ऑल दैट टेस्ट, 1 साल की पढ़ाई, फिर एग्ज़ाम्स, नो टाइम. Your hostel, I have, from last 2-3 days I am going near hostels now, girls hostel at least. They are very, distance is far. Take a 2-3 walk from there in the college, or go to the gate and come back. We know how much is the distance from main gate to our college? It's 1 kilometer. If you go and come back, we'll have 2 kilometers walk. It's easy, na? Listening music also and going for the walk, 2 ways it will be helping. Get enough sleep, that we are always taking. Meditation, that we don't try because it's very difficult to meditate. Concentration ही नहीं होता, can't sit, but it's useful. Try to start meditation. I think some lecture will be there on meditation also, yoga and meditation.